بسم الله الحمد لله والصلاة والسلام على نبينا محمد وعلى آله وصحبه وسلم. Inshallah, today our lecture regarding responding to symptoms in pharmacy practice. We will continue on the GIT symptoms, and today our lecture is about irritable bowel syndrome, IBS. Irritable bowel syndrome is a common disorder that affects the large intestine. It affects between 6 to 18% of the people worldwide. هي عندها high prevalence. إذا كان في كل 100 في 6 ل 18 that is mean there is a high prevalence of occurrence بتاع أو incidence بتاع ال IBS in the worldwide. Its signs and symptoms include cramping, abdominal pain, bloating, gas, and diarrhea or constipation or both. There is altered bowel habit, either diarrhea or constipation, or sometimes alternate, or sometimes both of them can occur in a certain individual. Only a smaller number of people with IBS have severe signs and symptoms. Some people can control their symptoms by managing diet, lifestyle, and stress. More severe symptoms can be treated with medication and counseling. Proper counseling and medication may be involved to treat or to manage more severe symptoms of IBS. The IBS is a chronic condition that needs long-term management. Here, a chronic condition, so that may need long-term management. There is no identifiable cause for the IBS. There is a debate. Is IBS has been fenced about? There is a debate has been fenced about whether IBS has a psychological cause, because it's associated with anxiety or depression in many patients. So that there is a debate. Is it there is a psychological cause or not? This is a debate. As a community pharmacist, what you need to know if there is a customer or a patient came to you in a community pharmacy complaining of symptoms of IBS, you should know the age, is it a child or adult, and the symptoms, gastrointestinal symptoms, their abdominal pain, abdominal distension or bloating, is there altered or disturbed bowel habit, diarrhea, constipation or alternate, nausea or other symptoms. You should also ask him if there is a urinary symptoms, especially increased frequency of urination. First, you should know the age because of difficulties in diagnosis of abdominal pain in children. It is best to refer, so that if in community pharmacy the customer or the complainer is a child, so that directly you should refer, because IBS is uncommon in children, and it is difficult to diagnose or differentiate between different causes of the abdominal pain in children. So it's better to refer children if they come with the symptoms of that resemble or like IBS. IBS usually develops in young adult life. This is very important, because if an older adult is presenting for the first time with no previous history of bowel problems, a referral should be made. إذا كان جاك older patient or customer, and for the first time he describing or complaining from symptoms of IBS, you should refer him directly, because usually the IBS develop in young adults, 20s 30s years old. إذا كان عنده history زي إذا كان عنده history أصلا من 20s and 30s, that is okay. But if there is no history and this for the first time, you should refer this older who complain from the symptoms of that resemble IBS directly, because it's uncommon in older if they doesn't, or if they haven't experienced these symptoms in 20s or 30s of age. The symptoms of IBS, we have three key symptoms: the abdominal pain, abdominal distension and bloating, and disturbance in the bowel habit. Three symptoms: abdominal pain and distension or bloating due to the gases, and the third symptom is a disturbance of the bowel habit. Usually the abdominal pain is characteristic in the IBS, in which may ease following the bowel movement after defecation. This means that after defecation, usually the abdominal pain that occur in the patient with IBS usually eased or relieved after defecation or after the bowel movement. Abdominal pain, the pain can occur anywhere in the abdomen. It is often central or left-sided and can be severe. When pain occurs in the upper abdomen, it can be confused with peptic ulcer, because of peptic ulcer there is an epigastric pain at the same time, or even can be also confused with the gallbladder pain. The site of the pain can vary from person to person and even for an individual. يعني حتى في individuals البين can vary from side to side. Sometimes the pain comes on and come on after eating and can be relieved by defecation. ودي قلنا هي characteristic feature that البين الابdominal pain which relieved after defecation. This is a characteristic feature of the IBS patients or IBS sufferer. The second key symptoms اللي هي bloating, or a sensation of bloating is commonly reported. Sometimes it is so severe that clothes have to be loosened. تنصح المريض بأنه يلبس ملابس لطيفة أو ملابس loose ناعمة to avoid اللي هو أو to ease bloating الممكن يحصل. The bowel habit in IBS patient, about 20% of the patient with IBS experience alternating periods of diarrhea and constipation. Throughout each phase, they continue to experience pain relieved by the bowel movement, as we mentioned. A morning rush is a common. المريض IBS بيشعر بأنه هو he should go to the toilet for defecation, usually at the morning, where the patient feels an urgent desire to defecate several times after getting up in the morning and following breakfast, after which the bowels may settle. يعني دايما البول movement بتكون في المورنينج and كان ممكن also continue till the breakfast. Then after that the bowel settle. ما بيكون في bowel sensation بتاع bowel movement or defecation. The other symptoms you should know in the patient with IBS, nausea sometimes can occur. Vomiting is less common. Patients may also complain of apparently unrelated symptoms such as backache, feeling lethargic and tired. Also, this can occur in some patients. Urinary symptoms may be associated with IBS, such as frequency, urgency, and nocturnia, the need of the pass urine during the night. You should know the duration of the IBS symptoms, abdominal symptoms. Patients may be present when the when the first symptoms occur, or may describe a pattern of symptoms which has been going on for months or even for years. يعني ممكن يصادفك البيشنت هو جاي complaining from the first time، وممكن وفي الغالب انه هو يجيك يوريك انه هي continuing symptoms for months or even for years, because we mentioned that this is it is a chronic IBS, a chronic illness. If an older person is presenting for the first time, referral is the most appropriate, as we mentioned. You should know also the previous history. You need to know whether the patient has consulted his/her doctor about the symptoms, and if so, what they were told the patient. Uh, Also, you should know a history of travel abroad, and gastroenteritis sometimes appear to trigger an IBS. الجاستروenteritis بالذات في الريسنت ترافلينج، انه الريسنت ترافلينج ممكن يعمل لي جاستروenteritis، والجاستروenteritis هي تريجر للاي بي اس، يحصل اللي هو exacerbation للاي بي اس symptoms. Referral is necessary to exclude any unresolved infection. إذا شعرت إنه هو المريض ده ممكن جاي هو newly traveled أو عنده travel abroad، هو في معناه عرضة لأنه يكون عنده gastroenteritis أو اللي هو دايما يحصل infection نتيجة للأبورد travel. ففي الحالة دي to exclude an unresolved infection محتاج ل antibiotics whatever. It's not your responsibility, so it is better to refer this patient. Any history of previous bowel surgery also would suggest a need of referral to avoid if there is a abdominal obstruction or whatever. خاصة إذا كان if the patient having a history of bowel surgery وجا هو جاء and he came to you in the pharmacy complaining of the IBS symptoms. When you ask him, you know that he have a previous bowel surgery. Directly, you should refer this patient to avoid any other serious problems such as an abdominal obstruction or another problem. Now we're talking about the aggravating factor. The aggravating factors for an IBS. All of the people in the community that they know that some foods can aggravate their symptoms and IBS symptoms. The role of food allergy or intolerance in IBS is not fully understood, but many people have worse IBS symptoms when they eat or drink certain foods or beverages, including wheat, dairy products, citrus fruits, beans, cabbage, milk, chocolate, onions, garlic, chips, leeks, and carbonated drinks. Carbonated drinks طيب اللي هي اللي فيها الغازات، المشروبات الغازية carbonated drinks. Caffeine often worsens the symptoms and its stimulant effects on the bowel and irritant effect on the stomach as well known in any case. معروف الكافيين هو لأنه stimulant بيعمل irritant للstomach، وإيفن حتى هو كان stimulate ال HCl secretion بالنسبة للناس اللي عندهم peptic ulcer. فبالتالي واحد من الaggravating factor هو الكافيين. One of your best advice is to avoid أو minimize أو decrease أو even avoid الكافيين اللي هو drinking اللي هي في الكوفي and even في التي إذا minimize في البيشن عندهم IBS. Also the sweeteners sorbitol and fructose have been also reported to aggravate IBS. This is some of the foods that can اللي هو أو should be avoided in the patient عندهم IBS irritable bowel syndrome. I should avoid these different types of foods. Also we find the stress is known to be اللي هو to worsen the symptoms of IBS. Most people with IBS experience worse or more frequent signs and symptoms during periods of increased stress. But while stress may aggravate the symptoms, it does not cause some. يعني هو بيعمل aggravation للsymptoms لكن هو ما هو الكود بتاع الsymptom. لكن if the symptoms already present have been present, the stress can worsen these IBS symptoms. Also the hormones, especially the estrogen women are twice as likely to have IBS, which might indicate that hormonal changes play a role, especially اللي هو الأستروجين is involved in these changes. Many women find that signs and symptoms are worsened during or around their menstrual periods. فإذا في correlation أو في علاقة there is a relationship between the hormone changes and the IBS. The medication, you should ask the patient or the customer for the current medication and prescribed and OTC medication. The patient may already have tried prescribed or OTC medicines to treat the condition. You need to know what has been tried and whether it produced any improvement. It is also important to know what other medicine the patient is taking to avoid drug interaction and adverse drug reaction. The IBS is associated with anxiety and depression in many patients, but it's not known whether it is the cause or effect. فعشان كده نحن قلنا هي عندها علاقة أو زي a debate. In the early slide we mentioned that there is a debate. Is it there is a psychological relationship between IBS and this psychological disorders, depression and anxiety? When to refer the patient that complain from the symptoms of IBS هي the three key symptoms: abdominal pain, abdominal bloating or flatulence, and the altered bowel habit. First, if the symptoms occur in children, you should refer this child. In all the person with no obvious history of IBS. Also, if the symptoms occur in a pregnant woman, if there is a blood in stool, if there is unexplained weight loss, to avoid, because usually in many cases the unexplained weight loss may indicate serious problem, serious pathology such as cancer and another symptoms or another disorders. Caution in patients aged over 45 with changed bowel habit. You should also take care and you should take caution if the patient over 45 age and that suffer from a changed bowel habit. You should refer him. It is better to exclude or to avoid any serious problem indication. Signs of bowel obstruction اذا كان لو اتكلمنا عنها في الكونستيبيشن، الساينس بتاعت البول استراكشن اذا كان في ساين بتاعت بول استراكشن such as الابدومينال بين وغيره او السفير ابدومينال بين وغيره، فديك you should refer the patient. Unresponsive to appropriate treatment اذا كان البيشنت اديته OTC medication for ال IBS after and you told him to take this medication for 1 week. After that time, if he came to you and there is no response, obvious response, you can refer him, or you can change him. You can change the OTC medication, especially antispasmodic drug, and give him a chance for another week. If there is no improvement, in the symptoms, although you have give him 2 different antispasmodic agents for 2 different weeks, then it is better to refer this patient because there is no response for this treatment. The treatment time scale: symptoms should start to improve within 1 week. Now we'll talk about the management of IBS. First, non-pharmacological management. Mild signs and symptoms can often be controlled by managing stress and by making changes in diet and lifestyle. The patient can be advised to first avoid foods that trigger IBS, and every patient by experience will know which food that can aggravate or can trigger him or her symptoms. You should also advise him to eat high fiber foods and drink plenty of fluids, increase the fluid intake. Exercise regularly because we mentioned that exercise can reserve the normal bowel habit. Get enough sleep. to avoid stress and anxiety, and even can also improve gut movement. Check labels at the supermarket to avoid caffeine and sweeteners such as السوربيتول والفركتوز الممكن which can occur في البيفرج أو في whatever juice or whatever. You should check these to avoid these because they are known to aggravate IBS symptoms. The first choice for management of IBS اللي هي الانتيسباسموديك. Antispasmodic are the mainstay هم الأساسيات of OTC treatment of IBS, and research trials show consistent improvement in abdominal pain with smooth muscle relaxant واللي هم عندنا OTC that approved for as antispasmodic in treatment of IBS. We have 3 drugs. We have Alverine citrate, we have peppermint oil, and we have mepivrine. These are O2C antispasmodic. Although in Sudan here in our country, in real practice, we seldomly or rarely use these approved O2C medication. دائما احنا عندنا هنا اللي هي الدروج اوف تشويس والناس اللي بيستخدموا في كل الكوميونيتي فارماسيز اللي هو بيستخدموا الكومبينيشن بتاع الكلور ديازيبوكسايد مع الكلينيديوم برومايد. وهو بالمناسبة this is not O2C medication، هو ما O2C medication. as a real practice احنا بنتكلم عن real practice المفروض تحصل، لكن what is happen actually occur نحن ان شاء الله will try to change. زي work اللي هو الالفرين citrate والبيبرمنت والميبيفرين هم they work by a direct effect on the smooth muscle of the gut, causing relaxation and thus reducing the abdominal pain. The patient should see an improvement within a few days of starting treatment and should be asked to return to you in 1 week to monitor the progress. إذا في progress it is okay. If there is no response, you can try another antispasmodic for 1 week, and if there is a response, it is better. If there is no response, then you can revert. It's worth trying a different antispasmodic, as I mentioned, if the first has not worked. Side effects from antispasmodic are rare. All antispasmodics are contraindicated in paralytic ileus. وهي actually this is a serious but fortunately rare condition in which the gut is not functioning and it is obstructed, causing severe pain, no bowel movement, and possibly vomiting of partly digested food. الvomiting بيكون فيه digested food, that means إنه الfood coming from a small intestine. This food coming from a small intestine. Immediate referral is needed. The alverine citrate is given in a dose of 60 to 120 milligram, 1 or 2 tablets or capsules, up to 3 times per day. Alverine citrate should not be recommended for pregnant or breastfeeding women or for children. It is also available in a combination product with stericula and with simiscon. stericula اللي هو bulk forming laxative وسيمسكون اللي هو antiflatulent surface active agent that inhibit اللي هو الفوم formation، بالتالي بيشتغل as antiflatulent سيمسكون. We have a peppermint oil has been used for many years as an aid to digestion and has an antispasmodic effect. Capsule containing 0.2 ml of the oil are taken in a dose of 1 or 2 capsules 3 times per day, 15 to 30 minutes before the meals. It can cause, peppermint oil can cause heart pain, and so it's best avoided in patients who already suffer from this problem اللي هم اللي عندهم heart pain أو peptic ulcer اللي هم should avoid the peppermint oil. We have mepivrine hydrochloride is used as at a dose of 135 milligram 3 times a day. The dose should be taken 20 minutes before the meal. Biliverdin should not be recommended for pregnant or breastfeeding women or for children under 10 years old or for patients with porphyria. In the management of الاي بي اس قلنا هي المانجمنت هي symptomatic حسب السيمتومز اللي عند البيشنت. اذا كان the patient suffering from constipation it is better to give him a bulk forming laxative. البلك forming laxative is a drug of choice here لانها هي free of adverse effects يمكن او يعني minor adverse effects we can it's better say that. Bulking agents such as constipation, as we know, is very common in IBS. Bulking agents such as psyllium containing soluble fiber can help some patients. Remind the patient to increase the fluid intake as we talk in this when we talk about the constipation and bulk forming laxatives. The patient may complain from diarrhea, in which frequent loose stools are common in IBS and are a symptom of the diarrheal اللي هو predominant type. يعني predominant type يعني احيانا المرضى اللي عندهم الاي بي اس يكون الدومينانت بتاعتهم هي يكون عندهم diarrhea. Others may be الدومينانت بتاعتهم يكون عندهم constipation. Stools may also contain mucus. This is one of the features that can occur in the patient with IBS. Mucus في الstool. Use of OTC antidiarrheal such as loperamide is appropriate only on an occasional short-term basis. يعني نستخدمه ما طوالي ما باستمرار not in chronic basis فقط في occasional يعني أحيانا في شنو في short term basis لمدة بتاعت يوم يومين يوقف الدواء يومين ثلاثة. This is short term basis. That is all. Now we have a case اللي هو we have Joanna Mathers is a 29 years old woman who asked to speak to the pharmacist. Came to you in the community pharmacy and she asked where is the pharmacist. She want to talk to the pharmacist. She has seen an advertisement for an antispasmodic for an IBS and wonders whether she should try it. شافت في التلفزيون on TV or newspaper whatever and she want to ask about this antispasmodic agent. On questioning لما سألتها she tells you that she has been getting stomach pain and bowel symptoms for several months, 2 or 3 times a month. She thinks her symptoms seem to be associated with business lunches and dinners at important meetings and include abdominal pain, feeling of abdominal fullness, diarrhea, nausea, sometimes vomiting. In answer to your specific question about morning symptoms, Joanna says that sometimes she feels she needs to go to the toilet first things in the morning and may have to go several times. Sometimes Joanna has been late for work because she felt that she couldn't leave the house due to the diarrhea. Joanna tells you that she works as a marketing executive and that her job is pressurized and stressful when there are big deadlines on client meetings. Joanna drinks 6 or 7 cups of coffee a day and says her diet is whatever I can't get at work and sometimes from the freezer when I get home. She is not taking any other medicine and has not been to the doctor about her problems as she didn't want to bother him. What is your recommendation? It is clear that Joanna symptoms indicate IBS اللي هي ال 3 keys كلها the 3 keys of ال IBS symptoms are occur in this Joanna mothers. These symptoms including an abdominal pain, you can use a highlighter. uh, abdominal pain and abdominal fullness, even diarrhea, nausea, and sometimes vomiting. These are symptoms of IBS. Also the second key symptoms is that اللي هو a change في البول habit. change في البول habit هي that she feels that she need to go to toilet for the first thing in the morning and may have to go several times. This is also a characteristic feature in اللي هو الالتر bowel habit. characteristic feature وبالذات at this button اللي هو morning button. This is a characteristic feature in the Joanna. What it is clear also these symptoms are related to stress. This customer or patient Joanna suffer from stress اللي هي work stress. هي شغاله هي اللي هي marketing executive وعندها هي pressurized and stressful especially لما يكون في ديدلاين او في ميتنج مع الزباين كلينت ميتينجز او في ديدلاين معين. واضح ان هي الجوب بتاعتها ستريسفول جوب also. طيب this is يمكن تكون الكلينيكال ساينس عن symptoms او السيمتومز بتاعت الاي بي اس. واضح ان هي suffer from الاي بي اس. The question is that what is your recommendation? The answer, this Joanna, she should try antispasmodic. You should give her antispasmodic, either mepivirine or L-Virine or peppermint oil or any one of these. You should give this antispasmodic or to see antispasmodic for 1 week, which can resolve her abdominal pain, which can resolve her abdominal pain. and even الابdominal fullness اللي هو bloating. abdominal fullness and bloating. This is the first choice. And when you give her this OTC medication, you should note this patient that you should use this drug for 1 week, and if and to come you back after that time to evaluate if there is improvement. She can continue till the symptoms till she can be free of the symptoms. If there is no improvement, you can try another antispasmodic for another 1 week more. وبرضه كمان you should ask her to come to you after the next week after taking the second أو the new أو the altered أو اللي هو البديل الانتيسبازماتيك الثاني to evaluate. If there is improvement, it's better. If there is no improvement, you should then ask her to refer to her physician. One of the most important thing here also, you should explain her the aggravating factors for the IBS, and here we have 2 aggravating factors. The first اللي هو الستريس. She tried to decrease the stress, whatever is it applicable or not. And the second aggravating factor اللي هو الconsumption بتاع الكافيين. She take 6 to 7 cups per day. She should reduce this اللي هو coffee consumption. Should reduce it because it's one of the aggravating factor. Also, Joanna have a problem in her diet because she say in here she whatever I can get at the work يعني هي فقط ما عندها and sometimes from the freezer. فواضح انها هي عندها مشكلة في الديت بتاعها. You should also advise her about to increase the fiber intake, the fluid intake, and what we talk in the first slide regarding the management. Okay, I think that is all about this case, Joanna case. I think that is all about our symptom today اللي هي ال IBS symptoms. inshallah, thank you for listening. Inshallah, we'll listen to me in the next lecture. Assalamu alaikum wa rahmatullahi wa barakatuh.